Hello, I'm Dr. Scott McKay, a veterinarian with Drs. Foster and Smith. I'd like to share with you a few thoughts on heartworm disease, a very serious but almost 100% preventable illness affecting dogs and other pets. The adult heartworm can grow to a length of 12 to 14 inches. They reside in the large blood vessels leading away from the heart, where they are nourished by the dog's blood. Actually, the name heartworm disease is a little misleading, since most of the damage done by this parasite is in the vessels of the animal's lungs. The presence of these worms in the pulmonary vessels of a dog causes serious damage to these blood vessels. It is only in the later stages of this disease that the worms enter the chambers of the heart. Heartworm disease is now found in all 50 states, and if left untreated, this disease is fatal. The best protection against heartworm disease for your pet is the year-round use of a heartworm preventative, even in areas where mosquitoes, which transmit this parasite, only occur seasonally. Some heartworm preventative medications also control intestinal parasites, such as roundworms and hookworms, which can infect people. Let's take an illustrated look at the life cycle of the heartworm.
Since heartworm disease was first recognized in the United States, there's been a continual spread throughout the country of this potentially fatal disease in dogs. The primary targets for the heartworm parasite are dogs and their wild cousins, such as coyotes, wolves, and foxes. Cats can also get life-threatening infections with heartworms. Cats don't typically spread infection back to the intermediate host, the mosquito. Mosquitoes are necessary to spread heartworm disease from animal to animal. Fortunately, heartworm disease is entirely preventable. Adult heartworms, which can reach 1 foot in length, are found in the heart and nearby blood vessels, where they damage the vessels and reproduce. After mating, female heartworms produce thousands of tiny larvae called microfilaria. These microfilaria circulate throughout the body in blood vessels, including the capillaries under the skin, where they are available to be ingested by mosquitoes. Across the U.S., there are many species of mosquitoes that are capable of transmitting heartworms. Dogs are common targets of mosquitoes as heartworm infections occur in animals kept both indoors and outdoors. The mosquito, while taking a blood meal, ingests microfilaria from an infected dog's blood. The engorged mosquito is now infected with microfilaria. These immature heartworm larvae continue their development inside the mosquito. The microfilaria enter the body cavity of the mosquito, where they develop over the next 10 to 14 days. Before this mosquito can infect another dog, these larvae must undergo this development phase. As the microfilaria mature and become infective larvae, they migrate to the mouth parts of the mosquito to be in position to infect another host. The life cycle is continued when the infected mosquito takes another blood meal from either the same dog or another dog. As the mosquito prepares to take a blood meal, a fascinating chain of events occurs. To feed, the needle-like stylet penetrates the skin, and the protective labium, or lip, of the mosquito flexes. As the mosquito feeds, infective larvae erupt through the tip of the labium and are deposited on the surface of the skin. After the mosquito withdraws its stylet, the infective larvae enter the dog through the bite wound in the dog's skin. The heartworm larvae develop while migrating through the dog's connective tissue. This process takes approximately 3 to 4 months. During this time, the larvae, which were microscopic, develop to be approximately 1/2 to 3/4 of an inch in length. After this tissue development stage, the larvae migrate to a nearby vein and burrow in. Once inside, the flowing blood carries them to the heart and major blood vessels within the lungs. Once these young heartworms reach the heart and large vessels of the lung, they are in the perfect environment for their continued growth and development. The gentle flow of blood through the vessels of the lung makes it easy for the young heartworms to swim, move about, and cause mechanical damage to the vessel walls. The nutrient-rich blood provides an ideal food source, promoting the rapid growth of the young heartworms to their adult size. Since heartworms may develop to be up to 1 foot in length and large numbers can infect a single dog, these worms can cause health problems, coughing, and difficulty breathing, and may lead to death of the infected animal. Once mature, the heartworms breed and the female begins to reproduce live young. The life cycle is now complete. and another dog is now capable of infecting more mosquitoes, causing further spread of this disease.
The American Heartworm Society recommends that all dogs be tested for heartworm disease before beginning a heartworm preventative program. In addition, dogs should be retested on an annual basis to make sure the preventative program is working. If test results indicate that your dog has heartworm disease, a treatment protocol, including a powerful medication, is usually prescribed to kill the adult heartworms. This treatment involves a hospital stay during which the medication is given in a series of injections. After treatment, the dog must be kept very quiet for several weeks to avoid complications as the adult heartworms die. In very serious infections, adult heartworms can be removed surgically from the dog's heart. Heartworm disease is a serious condition that fortunately is preventable. Indeed, prevention is much easier, safer, and less expensive than treatment. If your dog is not currently on a heartworm preventative, talk with your veterinarian today about the prevention of this disease.